Now, the Zimbabwe Human Rights Commission is working with South Africa's Public Protector Adv Kholeka Gcaleka to deal with complaints that Zimbabwean citizens are being turned away from public hospitals in the country. This comes after several reports showed that some hospitals are refusing to treat not only Zimbabweans, but indeed foreign nationals at large. The Zimbabwean government has also said it will not pay for its citizens to get medical help in South Africa. The Commission's chairperson, Jessie Majome, emphasized the need for Zimbabwe to improve its healthcare system. And she joins us now for more. Jessie, thank you so much for the time. Really appreciate it. So let's talk about the meeting and the engagement then with the Public Protector, Advocate Kholeka Gcaleka, there as well. What's that conversation been like and what has come out of it?
The conversation with my counterpart, this South African Public Protector Advocate Gcaleka, it was to show our mutual interest in having our countries beneficially resolve the issue of the conflicts that are arising when Zimbabwean nationals approach South African hospitals to seek services. This conversation is actually not a new conversation. In September 2024, the South African Public Protector, Advocate Gcaleka, very graciously hosted my commission, because the Zimbabwe Human Rights Commission has a dual mandate. It is the National Human Rights Institution. It is also the Public Protector Institute. So she graciously hosted us for a benchmarking and learning visit, because we came to learn how the South African Public Protector conducts its mandate and overcomes difficulties that it encounters, so that we can also grow and improve our function. And in that visit, Advocate Gcaleka and myself had a conversation that started about that problem that's in the media a lot, about Zimbabweans seeking help. And we agreed that we want to come together and devise ways of coming up with lasting solutions, like what I can call a root cause approach, to ensure that Zimbabweans, like all human beings, and all as South Africans who are in South Africa, also enjoy their rights freely, because there should not be conflict around this. And we've just finished a round of the learning visits, because we started with South Africa, then we went to Kenya and Uganda. So we have just synthesized the outcome of the visits, and so it is now time for us to resume that collaboration, because it was a very good engagement where we are in agreement that we need to see if we can find each other. So what we now need to do is to conclude that. But the good thing is that we agreed that for the benefits of our countries and for the nationals of our countries, it's not a problem that cannot be resolved, but that is Southern African states who are neighbors, and who are Africans, all of us, we can find lasting solutions to de-escalate this very unfortunate and needless and avoidable issue where human beings across required to have their dignity and their rights respected, but also right round, because human rights they impact the rights of others as well.
Jessie, what is the long-lasting solution here? Because, the fear is that we'll talk about a long-lasting solution, but it will be predicated on whether there is still more pressure on South Africa's healthcare services, which makes it more South Africa problem than it is a foreign national's problem by the sounds of it. And I stand corrected on that too. But what do you think then could be a long-lasting solution?
Okay. The long-lasting solution is, I think, the continuous mutual respect and engagement of both countries, and for also, in terms of the Zimbabwean situation, an improvement in the healthcare system of Zimbabwe, so that Zimbabweans, so that Zimbabweans are also as happy to access their public health institutions, but that's also part of the problem. And so that we can also have South Africans coming to Zimbabwe to seek healthcare services, not only on the high end, because there are also very high-end medical facilities in Zimbabwe where people come from all over the world, even from South Africa and otherwise. But for the population, the sector of the population that is not well resourced, that require to use public health systems, we want, there's a need, and the Zimbabwe Human Rights Commission continues to engage also the Ministry of Health in Zimbabwe to continue to improve the healthcare system, because that will solve part of the problem. And why do I say that? I say that because some of the Zimbabweans that are in South Africa regularly and legitimately. But if there is intolerance and xenophobia, even those who are regularly in South Africa and also contributing to the South African economy also bear the brunt of, I think, very negative, how can I call it, attitudes, which are not
Yeah.
helpful for South Africa or for Zimbabwe. But the bottom line is that we should and we can find lasting solutions on the Zimbabwean side. That continues, but also on the South African side, I think there's also need for, in my very respectful view, increased understanding of sometimes the needs of people and the needs of nations at different times. I want to go as far as to say that possibly also during the struggle for South Africa's independence, a lot of African countries, including Zimbabwe, hosted South Africans who were there, not of their own making. And so, that humanity, that Ubuntu that we Africans have, I think should continue to pervade and lead such discussions and such actions, because at the end of the day, we really are one people. There might be issues here, issues there, but it does not detract from our human and, let me say, African dignity. And we must, of course, find
Yeah.
these solutions and these conflicts.
Jessie, ultimately, this is being called and I suppose labeled as xenophobic. Would you agree with that notion that indeed it is xenophobic, or is it just in many ways South Africans saying that they're looking out for themselves and ensuring that their healthcare is also able to look out for them too? Because some feel that they aren't able to get the healthcare that they also deserve, and that instead it is foreign nationals that perhaps are being prioritized here.
I have to be frank and say that this is xenophobic in a lot of respects, because when a person presents themselves to a healthcare institution, they require services, and if they are of a particular nationality or are assumed to be of a particular nationality, they might not even be, by the way, then it's assumed that they don't deserve health care. So from the whole Ubuntu perspective, compassion and respect and dignity is what comes. And then sometimes you help a person and you ask questions later. So I think it would not be xenophobia if it is based on proper scientific and statistical data to say that the number of that, if the South African health care system is suffering stress, there would need to be clear evidence that it is because of Zimbabweans. There could be other factors, there could be other reasons. There are a lot of reasons, because even right now, South Africa, from what we read from the media, is also suffering a backlash from its policies about the rights of the the land rights in South Africa that have been pronounced by the American government, for example. And issues like lines of trade and tariffs and issues like that can also have an impact. But if we, so what I'm saying is that solutions that start with with labeling people because of their identity, yes, they don't support the rights, and they don't promote Ubuntu, and the solutions usually lie elsewhere, and starting there obscures the problem. And like I said, I'm confident, very confident that as we keep also working with the Zimbabwean government and urging it to prioritize health systems delivery, even if that happens, there might still be people who prefer to go to South Africa
Yep.
to to get treated. Yep. So it's a positive actually for the South African system, because it shows it's actually there are ways of looking at it that South Africa is doing very well, and that's a symptom, and not necessarily look at it as a problem.
I think,
and maybe there needs to be ways of making sure that there's contribution to that for that care, so that it continues to serve South Africans, because they have a right to healthcare systems, as well as others who come in. There are ways, like I said, when we sit together and as Africans, we do not fail to find solutions to this problem.